Hello, my name is Evelyn Antley, and I'm a Clemson University nurse practitioner student. Today, I am presenting a new patient to our office. She's a 38-year-old white female coming in with a chief complaint of neck and shoulder pain. She says that this pain has been present for about a year and is now increasing in intensity. She reports and described her neck pain as a constant aching pain that increases with turning her head to the right or looking over her right shoulder. She says that this pain is increased if she sleeps with her head elevated too high on pillows at night. The relieving factors of this pain is that when she's taking a shower, hot water contact directly to the area helps soothe the pain and helps relaxes her muscles there. She also says that her shoulder pain is described as constant and increased over time with limited range of motion. Her associated symptoms with her shoulder pain, she reports numbness down her right arm that extends through her fingertips. She denies that she's had any type of injury to her neck or shoulder within the last year, and she said that with her right hand, the numbness, she says she feels a lot weaker on her right arm to where she cannot open certain items that she was able to open before, such as soda bottles or pickle jars. On her viewer systems, cardiac S1, S2 are noted. Lungs are clear to auscultation. Head, ears, eyes, nose, and throat are all within normal limits with no drainage or no redness or edema. She denies any type of smoking history, drug history, or alcohol use. Her past medical history, she does have degenerative lumbar disc to her lower back, which she had surgery on about a year and a half ago. She had surgery to relieve pressed nerves at that time. She has no known drug allergies, and currently she is taking Cymbalta 60 milligrams by mouth daily for PMS symptoms. On her physical exam, her neck showed no tenderness to touch, whether deep or light palpation. She did have increased discomfort when having her rotate her head to the right and looking over her right shoulder. These symptoms were not present when we had her turn her head to the left or looking over her left shoulder. Also, negative symptoms while we had patient lying down in the supine position. We raised both legs one at a time to see if she would have any associated pain of tenderness or discomfort to her neck region, in which she denied. We then had patients sit up on the side of the table and apply direct, mild pressure downward on her head to see if she had any discomfort to her neck, in which she denied. Next, we did a physical exam of the right shoulder. In this, we did inspect her trapezius muscles, and we did not see any wasting at this time. We had her do several range of motion exercises as she reported in her chief complaint that she had limited range of motions. We noted that she was able to perform most of her active range of motion except the external rotation of her right shoulder. She was able to do her internal rotation of right shoulder. She was able to do floor flexion, abduction, extension, and she was able to do resistance, pushing downward with both hands and pressing upwards. Only motion she could not do was her external rotation. She also could not take her arm outward and pull it back this way. She reports that the symptoms that she has in her right shoulder were not the same as within her left shoulder. So as we did all the physical exam on the right shoulder, we did the exact same examination on her left shoulder. Our differential diagnoses at this time would be muscle spasm, also degenerative joint disease, tendonitis of the right shoulder to rule out rotary cuff tear. Our treatment plan will be to do an MRI of her right shoulder, as she's had a previous x-ray already of that shoulder, and we will be getting those films from her previous provider. She also will be getting an x-ray of her neck, and depending on the results of that x-ray, if they're negative and we need more conclusive evidence, we will also get an MRI at that time. We will put the patient on a muscle relaxant and also do a CBC to look at her baseline lab work in our differential diagnosis of tendonitis. This patient we will see back in about 2 weeks to see if the muscle relaxant had helped with the shoulder and neck pain, and also to review her x-ray film and her MRI with her at that time. Once we see her back in the office in 2 weeks, we will continue our plan of care from that point. Thank you for this presentation. Thank you for listening.